Okay, let's be real for a sec. When you hear pelvic exam, it's not exactly like, woohoo, party time.
Yeah, and I think it's safe to say most people don't exactly jump for joy.
But honestly, the more you know about it, the less scary it gets. So if you're kind of feeling apprehensive about your next appointment,
This is the place to be.
we're going to break it all down
All those things you need to know.
about pelvic exams. And we're using this super helpful article from health.com.
Called Pelvic Exam, Purpose, Preparation, Risks, and Results.
We'll keep it nice and clear. No crazy medical jargon.
Yeah, just straight talk so you can feel empowered and confident.
Walk in there like you own the place. Okay, first things first, like myth-busting time.
Right off the bat.
You do not need a pelvic exam every single time you go to the gyno.
It's not like an oil change or something.
It's really more of a specific tool. Well, you have like symptoms or something you're worried about.
Exactly.
So when is a pelvic exam actually like necessary?
Well, there are a few key situations. Like if you have abnormal bleeding,
Like what?
spotting between periods, or like crazy heavy periods.
Oh, or even bleeding after menopause, right?
Yeah, exactly. So in those cases, a pelvic exam can help your doctor figure out what's going on.
Makes sense. What about pelvic pain?
Definitely another good reason. It can help pinpoint if it's coming from your uterus, ovaries.
Or other organs down there?
Mhm.
Oh, and what about pain during sex?
That too. You definitely want to bring that up with your doctor. A pelvic exam could be recommended for that as well.
So we've covered the whens. Now, is there anything that doesn't need a pelvic exam? Things people might think do, but don't.
You might be surprised, but routine STI screenings. You don't usually need one.
Oh, wow.
And most birth control methods, you don't need one either.
That's good news. It's amazing all the myths out there about this stuff.
Yeah, it's really important to get the facts straight so you can make informed decisions about your health care.
Okay, so say you do need a pelvic exam. What's the prep like?
It's really pretty easy. No need to fast
Yeah.
or change any meds.
Thank goodness.
Just empty your bladder beforehand.
Oh, that's a good tip.
It makes it way more comfortable.
I wish I had known that. And what about periods? Can you get one during your period?
It's totally okay to have the exam during your period, yeah.
Okay.
But, some people prefer not to.
It's up to you.
Yeah, whatever feels best.
Comfort is key. And speaking of comfort, a lot of people feel anxious about pelvic exams,
Of course.
especially if they've had like a bad experience in the past.
Absolutely. That's why you can always bring a support person.
Oh, that's a good idea.
It can really help to have someone there for support.
What about if someone is experiencing gender dysphoria?
That's a really important point. The article we're looking at actually talks about this. You can talk to your provider beforehand
Oh, good.
about things like what terms you prefer,
Okay.
and even ask for them to explain everything as they go. It's about making you feel as comfortable and respected as possible.
Communication to communication. Okay, so walk us through what actually happens during a pelvic exam, like step by step.
Okay, so first, you'll lie down on the exam table
Right.
with your feet in the stirrups.
Those stirrups.
I know they can feel a bit awkward, but they really do help with positioning.
So the doctor can see everything.
Yeah. So then, your provider will start by examining your vulva,
Which is?
the outer part of your genitals.
Oh, that's
Then
it.
comes the speculum.
Ah, the speculum.
It's usually plastic,
Okay.
and it gently opens the vaginal walls so they can see your cervix.
I think a lot of people get nervous about the speculum. What does it actually feel like?
You might feel some pressure when it's going in,
Okay.
but it shouldn't hurt. If it does, definitely speak up.
Please, please do.
Your provider can adjust or try a different size.
You're in control. So the speculum's in. What's next?
They might do a pap smear.
Oh, right. Using that little brush.
Yep, to collect cells from your cervix.
A lot of people have heard of a pap smear, but maybe don't totally get it. What's it for?
It's a screening test for cervical cancer. Checks for any abnormal cells.
Gotcha. So it's preventative. And how does it feel?
You might feel a little, like, scraping sensation,
Okay.
but it's super quick.
And then?
After the speculum comes out, they'll usually do a digital exam.
Digital exam.
Basically, they insert 1 or 2 gloved fingers into your vagina
Okay.
to feel your cervix and other organs. They might also press on your abdomen to get a better sense of your uterus and ovaries.
Ah, so it's like a more hands-on check.
Exactly. And sometimes they'll do a rectal exam too
So that's where they...
and sort of finger into your rectum.
Okay. So going back to that feeling anxious thing, any advice for people who get nervous?
First of all, those feelings are totally normal. You're not alone.
Right. And don't be afraid to ask your provider to explain what they're doing
Oh, absolutely.
at any point.
Knowledge is power. Understanding can help so much with the anxiety.
It's all about being informed.
And if you feel uncomfortable at any point, tell them.
Always.
They can try to make adjustments.
You got it. Okay, so you've had the exam. What happens next?
Usually, your provider will tell you right away if they found anything, like any unusual lumps or anything.
Okay. What about the results from the pap smear?
Those usually take a week or two.
So a little waiting game, and then when you get them back, what are the possibilities?
There are basically 3 possible outcomes: normal, unclear, and abnormal.
All right, let's break those down. What does normal mean?
Normal is the best case scenario. It means there are no signs of abnormal cells.
Great. What if they say unclear?
Unclear is sometimes called ASCIS. It stands for atypical squamous cells of undetermined significance.
Whoa, that's a mouthful. What does that mean, like in plain English?
Basically, it means some cells look a little unusual,
Uh-oh.
but they don't know if it's like from hormones
Yeah.
or something more serious.
So it's kind of a we need more info situation.
Yeah, exactly. They might need to do some more tests.
Okay. Now, abnormal results. What does that mean?
Abnormal means there are definite changes in the cells
Oh.
that need to be looked at more closely. But, super important, abnormal doesn't automatically equal cancer.
I was just thinking that. So it's not an automatic panic situation.
Right. It just means they need to figure out what's causing those changes.
And this is where HPV comes in, right?
Exactly. HPG is super common, and some types of it can increase the risk of cervical cancer.
I've heard that like a lot of people get HPV at some point.
It's true, yeah. Something like 80% of sexually active people will.
Wow. So if your PAP's abnormal, they'll probably do an HPV test too.
Yeah, to see if that's a factor.
How does that test work?
It's similar to a PAP. They just take another cell sample during the exam and test it for the risky types of HPV.
Makes sense. And what are the possible results for the HPV test?
It can be negative, meaning they didn't find any of those risky types,
Phew.
or positive, meaning you do have one of the types that can sometimes lead to cancer.
So does a positive HPV test mean you have cancer?
No, not at all. Most people who have HPV will never get cervical cancer.
Okay, that's good to know.
A positive test just means they'll want to keep a closer eye on things, maybe do PAPs more often, or even a colposcopy.
Colposcopy, that's like a...
It's a way to get a really close look at your cervix with a special magnifying thing
Gotcha.
so they can see it really well
Yeah.
and decide if they need to do a biopsy.
And a biopsy is?
Just a tiny sample of tissue to check under a microscope.
Right, to rule out anything bad. So even if you get an abnormal PAP or a positive HPV test, there are steps you can take
Exactly.
to figure out what's up and catch things early.
Early detection is so important for cervical health.
It really seems like knowing what to expect makes a big difference.
Huge difference.
So much less scary when you know what's going on. But one thing we haven't talked about yet is the emotional side of all this. Like, a lot of people feel embarrassed or just weird about pelvic exams.
Oh, yeah. Go ahead.
And finding a provider you really trust, that feels like a big deal.
It's true.
We should probably talk more about that in part 2 of this deep dive.
Yeah, for sure. Pelvic exams can be emotionally loaded.
You know, I've heard that from a lot of people. Like, finding a doctor you feel good about, that can make all the difference.
Makes a huge difference, yeah. When you have that provider who really listens and respects your boundaries, creates a safe space.
It can totally change the whole experience.
It really can.
So how do you find that right provider? Like, what should you be looking for?
Honestly, trust your gut. If you meet with a doctor and something feels off, it's okay to keep looking.
It's kind of like dating in a way.
Right. You got to find someone you click with, someone you feel comfortable with taking care of, this part of your health. Don't be shy about asking questions.
Like during a consultation.
Yeah. Ask about their approach to pelvic exams, how they handle things like anxiety or past trauma, if they're willing to explain everything really clearly.
That's a good idea. What if someone has had a really bad experience with pelvic exams before? Like even trauma.
That's when it's extra important to find someone who's trauma-informed.
Is that a specific type of doctor?
Not necessarily a type, but more of an approach. There are a lot of providers who specialize in this, and they can offer more sensitive care.
What would they do differently?
Well, they might take more time to build trust,
Okay.
explain every single step in detail, give you more control over the pace, the positioning, maybe offer some grounding techniques to help with anxiety.
So it's about communication and making you feel in control.
Absolutely. And sometimes even having a support person there can be really helpful.
Right, like we talked about before.
Having that extra support can really make you feel safer.
Okay, let's switch gears a bit and go back to those test results.
Okay.
I want to make sure we're super clear on what they all mean and what happens next. So a normal pap smear, that's obviously what you want.
The best news.
But let's talk about those unclear results. The ASQS, that gray area.
Right. SQS means there are some cells that are a little bit off, but they need to do more testing to see if it's nothing to worry about or something more serious.
So what happens if you get an ACSUS result? What's next?
It depends on your age, your medical history, things like that. They might just want to repeat the PAP in a few months
Okay.
or maybe a year. See if things go back to normal.
And if they don't?
Then, or if you're over 30, they might recommend that HPV test to see if that's involved.
Okay, so that makes sense for the unclear results.
Hmm.
What about abnormal PAPs? We talked about it before, but it's normal to feel anxious about that, right?
Totally. But it's really important to remember, abnormal doesn't automatically mean cancer.
Right, right.
It just means they need to do more investigating.
So it's like a clue to look deeper
Exactly. And that HPV test is one of the ways they do that.
because of that connection between HPV and cervical cancer.
If the PAP's abnormal, they want to know if high-risk HPV is in the picture,
Yeah.
because that can make it more likely for those cells to become something more serious.
So let's say the HPV test IS positive. Then what?
Again, try not to freak out. It doesn't mean you have cancer. It just means they need to be more careful about monitoring.
What does that mean, monitoring?
Probably more frequent PAP smears, maybe every 6 months,
Yeah.
just to keep track of any changes.
Okay. Anything else? Other procedures?
Depending on the situation, they might suggest a colposcopy.
The close-up look, right?
Yep, exactly. It lets them really see what's going on and decide if a biopsy is necessary.
And a biopsy is that little tissue sample, so they can check it for bad cells. So even though those abnormal PAPs and positive HPV tests can be scary, there are things you can do
Absolutely.
to get more answers and catch anything early.
Early detection, so important.
We've covered so much. But there's one thing we haven't talked about yet. What if those further tests DO show something? Like, what if a biopsy comes back and it's not good news?
That's a big question.
And probably on a lot of minds.
We should definitely talk about that in the last part of our deep dive. It's a really important question. What happens if, after all that, the news isn't good?
Like, if you get a biopsy and they find something, concerning.
Yeah, so if a biopsy shows precancerous cells or even cancer, the next steps are going to be different for everyone.
What kinds of things would make it different?
It depends on how serious it is, like the stage, if it's cancer,
Yeah.
and also your overall health, your preferences.
Okay.
There are a lot of options, from, minimally invasive stuff to bigger surgeries.
It's not one size fits all.
Definitely not. Your doctor will work with you to figure out the best plan.
And I imagine it's a lot to handle emotionally. If you get a diagnosis like that, are there, support systems?
Oh, yeah, absolutely. It can be really overwhelming, both emotionally and just logistically. But there's a whole team to support you.
Okay, good.
Your doctor, nurses, social workers, therapists, they can help you navigate everything, answer your questions, connect you with resources.
It's good to know you're not alone.
Exactly. And even beyond your healthcare team, there are some great support groups out there.
sure.
Online communities, too. You
Yeah.
can connect with other people who are going through the same thing. It can be really powerful to share your story and hear from others.
I bet. There's strength in numbers.
For sure. And remember, the biggest thing through all of this is communication.
Like from the very beginning
Yep.
with the exam.
All the way through any treatment, even after.
Just making sure you speak up.
Advocate for yourself. Ask all the questions you need to. Make sure your voice is heard.
Thinking back to where we started, it's amazing how much better I feel just knowing more about all this.
Right.
We went from pelvic exam to actually understanding what's involved and what the different possibilities are.
Knowledge is power.
Totally.
Yeah.
And it's about feeling in control.
Right. And you're your own best advocate. Don't be afraid to get a second opinion if you need to. And always prioritize your own well-being.
That's great advice. So now that we've taken this deep dive together, what questions would you ask your provider to make sure you feel comfortable at your next visit? Remember, the more you know, the better. And talking openly is key to having a good experience.